Archie from CS15. We're the training provider for the JE3 Foundation. I'm here to show you exactly what to do if you come across a member of the public in cardiac arrest. So I found my patient on the floor and I'm going to go through the primary assessment using the Dr. ABC acronym. So the first thing I'm going to do is check for dangers. Is there any immediate dangers to myself before approaching the casualty? Is there any more dangers to the patient? Or is there any dangers to other rescuers that are going to come and assist me? In this situation, the patient seems safe to approach, so I'm going to approach from the feet, give my patient a little tap on the feet. Open your eyes for me, can you hear me? I got no response from that, so I'm going to come down and perform a shoulder shake. Open your eyes for me, can you hear me? There's no response from that, so I'm going to get my phone out, call 999 and check the airway. Make sure your phone's on speaker so you can get advice from the ambulance service. So to check the airway, I'm going to perform a head tilt chin lift by placing some fingers on the forehead, 2 fingers under the chin, head tilt, chin lift and opening the mouth. I'm now going to look, listen and feel for around 10 seconds, assessing the patient's breathing. I'm looking down the chest and abdomen to see rise and fall. I'm listening for normal breathing and I'm feeling on the side of my face for warm breath. In this situation, the patient isn't breathing normally, they're unresponsive, so I'm going to start chest compressions. A defibrillator or an AED is absolutely key within a cardiac arrest. Not all the time that we have a cardiac arrest, they're going to be in a shockable rhythm, but if they are in a shockable rhythm, that is the life-saving bit of kit. That is a machine that is going to stop that heart, restart it, put it back into a normal rhythm, basically make that patient dead to alive. One of the key things is finding where your nearest public access defibrillator is. Don't stress about this. When you call the ambulance service, they will tell you exactly where to locate your nearest defib. They will also have the passcode for any locked cabinets and give you exact directions to it. So in the last section, we went over the primary survey and recognition of out-of-hospital cardiac arrest. We are now going to go over CPR and the use of chest compressions with Finley, who is a CPR novice. So we are going to use one of these training mannequins to go over CPR just because it's not safe to do on a real person. But Finn, you ready to do it?
Yep, let's do it.
Right, so we've gone over our recognition of cardiac arrest. So again, I'm just going to do that head tilt chin lift. I'll have a good look in the airway, see if there's any vomit, aspirations, anything that shouldn't be in there. If there's anything in that airway that shouldn't be there, just tilt that patient's head to the side, let that drain out so you've got a nice clear airway to work with. Then you're going to have a good look, listen and feel. So you are looking down the centre of the chest and stomach, you're looking for rise and fall, you're listening for normal breathing in the side of your ear, and you're feeling for that warm breath on the side of your face. If that's absent or abnormal, we're going to start chest compressions. So I'm going to take my dominant hand, so I'm left-handed, then my left dominant hand is going to come on top. I'm going to interlace my fingers and place the heel of my hand bang in the centre of the patient's chest, just along the nipple line. You're going to push hard and fast, twice a second. 3, 4, 5, 6. And you're going to do continuous chest compressions until the ambulance arrives, or until an AED arrives and tells you to stand clear. You're going to be pushing about the depth of a credit card, so it's about 5 to 6 centimetres deep at a rate of, like I said, twice a second.
Right, Archie, so I'm going to do the head tilt chin lift, listen for any breathing and look down the chest for any raises.
Yeah.
If I don't see any raises, start chest compressions.
Hang on. That's it, your speed's perfect.
So how long have I got to do this for?
So you're going to keep going until the patient shows signs of life, until an ambulance arrives and takes over from you. So that doesn't mean when you see an ambulance, that means when you're physically told to stop, or until you physically cannot continue and someone else can take over from you. It's very tiring, so you are going to want someone to take over sooner rather than later. Right, so now I've had a chance to swap over and get some gloves on. Our defib should shortly be arriving. Right, so our defibrillator has arrived. If you open up the back for me, Finley, there's going to be some bits to get the patient prepped. Obviously, throughout our training, we've had a bare-chested mannequin, but normally when you come across a patient, they're going to have some clothes on. So in the back of your defib, there's a pair of gloves, so you can keep yourself protected. Gloves are really, really nice to have. They keep us safe, especially against any bodily fluids or anything like that. but it is not essential. We can always wash our hands. Keeping that blood pumping around the patient's body is the most important thing. So if you don't have any access to gloves, I'd go straight on bare hands, but gloves if you can. There should be a pair of scissors so you can cut off any clothing from the patient. And there should be a little towel in there as well. Just because the patient's very sweaty, you want to dry them down. If they're wet, the pads are not going to stick effectively to the patient. The last thing you're going to find is a prep razor. So it's just a little razor to remove any hair. If the patient's got a particularly hairy chest, those pads are again not going to stick effectively. So you just need to remove some of that hair to get the pads to stick straight on. So what I'm going to do, Finn, is I'll do the compressions for you. You're going to just take the machine out and just follow the instructions. The machine cannot do any wrong. It'll only shock the patient that needs a shock. It will talk you through every single part of the process. So I won't really talk throughout this, I'll just let you follow the prompts from the machine. All right?
Yeah.
Right, start when you're ready.
Adult mode. Remove all clothing from patient's chest. Pull red handle to reveal pads. Look at pictures on pads. Apply pads to bare skin exactly as shown in the pictures. Press pads firmly. Apply pads to bare skin exactly as
Just work
shown
around
in the
me.
pictures.
Oh, really?
Yeah.
This is here.
That's
Press
it, and I'll move
pads
my fingers.
firmly. Apply pads to bare skin exactly as shown in the pictures. Press pads firmly. Check pads for good contact to
So
bare
that pad
skin.
wants to come a little bit further down. Nope. That one there.
Check electrode tray connection.
Is that right?
Check pads for good contact to bare skin.
If you take over chest compressions,
Check electrode tray connection.
right on.
Check pads. Do not touch
Stand clear.
patient. Analyzing heart rhythm.
So you're just making sure that you're
Everyone
always
clear.
standing
Press
clear of the
flashing
patient,
button.
and then you can deliver your shock. Press the flashing button.
Shock delivered. Provide chest compressions to the beat.
And then whenever you're ready.
The heel of one hand should be in center of chest. The other hand should be on top
So
of
that tells you
first
exactly what to do.
hand. Push down hard at least 5 centimeters.
Perfect.
Provide 2 breaths. 1,
Not giving the rescue breath, so you just continue.
resume chest compressions. Push down hard at least 5 centimeters. Resume
Turn that
chest
off.
compressions.
Yeah.
Push down hard at least 5 centimeters.
Right, so I'll just wind it up.
Provide 2.
Right, so as you saw, first of all, the pads weren't in the correct place, but it just took a little bit of movement, and then they're spot on. That's the fantastic thing about these machines. You cannot do anything wrong. As you saw, it just keeps you nice and calm, tells you exactly what to do. You just need a little adjustment, and then you're bang on. So really nice work. First shock might not always work with a patient, so this machine will deliver as many shocks as the patient needs. You just keep going around in those 2-minute cycles, again, until the patient starts showing signs of life, until the ambulance service tell you to stop, or until someone else has to take over from you. But the machine will just keep giving you that support, keep giving you the information you need. If you're in any doubt for any reason, you've still got the ambulance service on the end of the phone giving you that advice. If the patient does successfully come back, the machine will say no shock advised, and check for signs of life. You're going to check for those signs of life. Again, if you're unsure, just ask your call handler and they can walk you through the whole process. So Finley, the last sort of section we're going to cover is the recovery position. So one or two reasons you're going to put someone into the recovery position. Either if we've successfully resuscitated them before an ambulance arrives, you're going to leave the pads on them, put them in the recovery position so they don't choke on any vomit, their tongue, anything like that. Or if they are breathing normally, remember when we did that primary assessment, the first thing we did, once you get down to response, if they're unresponsive but the airway's clear and they're breathing normally, we just want that patient on their side until an ambulance arrives, just so that airway is nice and safe throughout. Right, Finley, so we're going to go over the recovery position, also known as a safe airway position. Any patient that is unconscious but is now breathing normally, so whether that's after a cardiac arrest or straight away in your primary survey, if that patient is breathing normally but you cannot wake them up, you're going to put them into a safe airway position or the recovery position. Reason for this, if the tongue falls to the back of the throat, it's going to close off that airway, or if the patient vomits or aspirates, you need them on their side. So the first thing you're going to do, you're going to get the hand closest to you and just bring it up and out the way at a right angle. Then you're going to take the hand furthest away and pop it up to the patient's ear. You're going to hold that in place. Then you're going to take the knee furthest from you and bring it up. And then you're going to roll the patient towards you. Bring the leg up. Perfect. Check the patient's airway, make sure they're breathing normally. Tilt the head back if needs be. And then you're just going to monitor and assess your patient until the ambulance arrives. Keep them warm, comfort and reassure them.